Hello, everyone. Good afternoon. My name is Todd Hughes, and I'm the director of the California Health Interview Survey, or CHIS, the nation's largest ongoing state health survey, which is conducted here at the UCLA Center for Health Policy Research. Welcome to today's online seminar, Census Undercount for Latino Immigrants, Impact on Health and Social Programs in Los Angeles. The seminar is quite special to me as I started my career in survey statistics nearly 25 years ago, knocking on doors as a field worker for the US Census Bureau, and eventually becoming the Assistant Division Chief of the Census Bureau's American Community Survey, the largest ongoing household survey in the nation. Last week, most households in the country received a mailed invitation to complete the 2020 census, and I hope that all of you went online to fill it out. But if you haven't, I encourage you to do so today. The Census Bureau conducts its decennial head count of the national population in order to provide critical data that affects community funding, congressional representation, and more. It's always a challenge and focus of the US Census Bureau to ensure that all groups are fully counted and represented in the decennial census count. This cycle, there is a concern that immigrant groups, particularly Latinos, may be fearful and less willing to participate due to the current administration's anti-immigrant rhetoric and policies, including the proposed addition of a citizenship question, which was blocked by the Supreme Court. Community organizations, advocates, and other groups like the ones many of you lead and work with have been conducting outreach to immigrant populations to eliminate concerns and ensure an accurate count. This is key, as data from the 2020 census will be used to determine public funding to various national, state, and local level programs for the next decade. An undercount may have a harmful impact on health and other social service programs in California and beyond, from the Supplemental Nutrition Assistance Program, or SNAP, to the Housing Choice Voucher Program, or Section 8, to Head Start and the Health Center Program. As of March 24, 26.2% of households across the nation and 25.2% of California households have responded to the 2020 census. And these next weeks are crucial for outreach and efforts to ensure an accurate and representative count. Today, we welcome UCLA Center for Health Policy Research Associate Director Dr. Stephen P. Wallace, an expert on immigrant health and the principal investigator of the Research on Immigrant Health and State Policy, or RIGHTS study, who will share findings of a recent study he conducted with colleagues on funding at risk in Los Angeles County for healthcare and social services. He will cover the overall implications if Latinos are undercounted in the census. If you're interested in today's slides, you can request them from our communications department at the email address that we'll show you here on the screen. And please stay tuned for announcements on our upcoming seminar on Wednesday, May 20th, that evaluates exposure to secondhand smoke among multi-unit housing residents and support of smoke-free MUH policies. Now, let's begin today's discussion with Dr. Wallace.
Thank you, Todd. Of course, there's always the challenge of getting the slides to work. So I think we're working now. I appreciate everybody who's joining us today to talk about a very timely topic, the census, which we're right in the middle of gathering data on, and the impact of a potential Latino undercount on health and social programs in Los Angeles. I want to acknowledge the co-authors, Angu Khan, who is a doctoral student here at UCLA and did put the elbow grease into the calculations and the data collection, and Homero Del Pino, who was a collaborator in the design and analysis of the data, and of course, all the other individuals who helped with reviews and data collection, etc. Also want to acknowledge the funding that we received from the UCLA CTSI through their grant listed here, and of course the disclaimer that the conclusions drawn from the study are not necessarily the views of the National Institutes of Health. Okay, so come on, there we go. So a little background. I think everybody knows that we do a national census once every 10 years. It is included in the very beginning of the US Constitution, Article 1, Section 2, that states that the government will conduct the census every 10 years. It was unusual at the time that the Constitution was written to include a census for making political empowerment for the governed by using it to apportion delegates to the legislature. Censuses in other countries in that era were mostly for taxing or for conscripting youth into the military service. So the history of the US Census really is one of political participation and empowerment. And we've had one every 10 years since 1790. There have been a variety of US laws around the census to enact that clause in the Constitution. And most recently, they were all codified in 1954. And so the census is now driven by Title 13. I bring this up because there's been a lot of discussion around assuring people that the census is confidential, and it is part of the US legal code that says that it's against the law to identify any individual or business from the census, and that the government, no agency or court, can use personal information from the census against respondents. So this is a pretty rock solid guarantee of confidentiality for the census, and all census employees are sworn to uphold Title 13 and face severe legal consequences if they do not. So that's important to keep in mind as we go through and talk about the potential undercount in the census. So the problem we're talking about today is a potential undercount. When I first became aware of the census as a young graduate student, I was shocked to find in 1980 that the US Census actually found 5 million more people than they expected. And at the time I left myself and said, where do you hide 5.5 million people? But if you think about the size of our country and the total population, it really doesn't take a lot to be hidden from sight. The reason in 1980 they found more people was both because they had better coverage. They did, as you can see on the door here, more knocking on doors of individuals. But they also vastly underestimated migration from Latin America during that era. So the census found a lot more people than they expected. After each census, the Census Bureau goes back and does some additional enumerations to determine how accurate the census itself was, and have found over the years, which is no surprise, is that people who are missed at the census are not missed randomly. It's not like every 10th door somebody forgets to knock on. The groups that are most likely to be missed by the census include American Indians and Alaska Natives, or AIAN, African Americans and Blacks, and Latinos. In addition, renters are more likely to be undercounted, in part because they're more likely to move, and the census is a household-based survey, not survey, enumeration. And males, both age 30 to 49 years old, are the most likely age group of males to be missed, but also 18 to 29-year-olds, and children 0 to 4. So these are all groups that are the most likely to be missed in the past censuses. This is data from the US Census based on their post-census quality control checks. And it shows the estimated undercount in 1990, 2000, and the last census in 2010. So 1990 was the least accurate census in a number of years. And as you can see, American Indians living on reservation, they estimated that 12.2% of those people living on reservation were not counted in the 1990 census. They got better in 2000 and slipped back again in 2010, where almost 5% weren't counted. Non-Hispanic Blacks similarly were undercounted, and Hispanics or Latinos were undercounted by 5% in the 1990 census and 1.5% in the 2010 census. At the far right, you see the total population. And what's interesting is in the 1990 census, they estimated that we were at, the total population of the country was undercounted by about 1.6%. That strange bar going below that says -5% suggests that in 2000, because of double counting of some individuals, they actually overcounted the population somewhat. And the 2020 census was considered to be right on the mark. But because some groups were undercounted, it also means that some groups were overcounted. And the situation for the 2020 census is yet to be decided. There are a couple issues where we can imagine undercounts are going to be worse than in the 2010 census. And I believe the coronavirus situation and large numbers of people in many states being confined to their homes could have either a hurtful or helpful effect on a total undercount. It could be helpful to the extent that people are stuck at home and get their letters and answer online because they're bored at home. It could also be that people that don't have internet access are not able to get to their libraries and so are undercounted in that way. Could be that people are distracted and distressed and so are not paying attention to the census as well. So there's a lot of dynamics occurring in the general population that might affect the census reapply. A number of factors in Los Angeles County specific that give us pause and worry about a potential undercount. So Los Angeles County has a large Latino population. As I mentioned, that's a population that's commonly undercounted. It has a large undocumented population. And while the census does not provide information on undercount around undocumented populations, that is part of the Latino population and is a group that's particularly likely to avoid government enumeration and other services. And then we have a large renter population, which, as I mentioned, the mobility of renters increases the chance that they'll be missed. So just briefly, we can see here that Los Angeles County is almost 50% Latino. That's higher than the state as a whole, which is about 40% Latino, and much higher than the United States as a whole, which is 18.3%, or about 1 out of 5 Latinos. So to the extent that Latinos are disproportionately overcounted, Los Angeles County is going to get hit harder than the United States as a whole, and even more than California as a whole. Similarly, the undocumented population comprises a disproportionate part of the Los Angeles County population. Based on national estimates divided up by counties, it appears that as much as 10.4% of the Los Angeles County population, total population, is undocumented. So that's a group that is the most likely to be sensitive to being contacted by government agencies. California as a whole is lower, 7.9, about 8%. In the US as a whole, the population a little over 3% is undocumented. So once again, a disproportionate lack of response by the undocumented population is going to hit Los Angeles County harder than the state as a whole and much harder than the country as a whole. And then finally, renters. California as a whole is 42.8% renters of the non-institutional population. LA County is half renters, and the US as a whole is about a third. So in California, there are only 2 counties that have more renters, that's San Francisco and Yolo County. So if we have a undercount of renters, that once again is going to disadvantage Los Angeles County more than almost anywhere else in California. So there's a concern, given the demographic composition just out the gate, that Los Angeles County is at risk of being undercounted. That becomes even more acute when you look at the dynamics around immigration and how that has particularly affected the Latino population in the country. Just after the last census, we've seen a large rise in deportations. In fact, between 2003 and 2013, the number of deportations nationally doubled to over 400,000 annually. While the number of deportations is down, the number of arrests has been rising and is very high invisibility and in the media and in people's minds, California sanctuary laws. So that increases the level of concern in immigrant communities. In addition, the continued discussion in political circles around a border wall, the publicity around immigrant and asylum exclusions at the border, and the dynamics of all of that continues to heighten anxiety in immigrant communities. And the proposal last year to add citizenship as a question on the census, which was stayed by the Supreme Court, added a lot of discussion around whether or not immigrants would be safe answering the census. There was a study at the time last summer that suggested simply adding that one question to the census would reduce the response rate by all Latinos nationally by 5.8%, just simply by having added that question. So while the census question on citizenship was blocked, the Supreme Court in January of this year allowed a ruling dealing with public charge for people applying for permanent immigration status to actually go forward. This has been discussed a lot in immigrant communities and is discouraging many immigrants from applying for benefits that they or their families are legally allowed for. And as a result, it's created a level of concern that any interaction with federal programs or authorities could harm their potential for future green cards. In a 2018 survey that we did in California, among people who responded in Spanish, 42% responded that they knew someone personally who had been deported. So this is just an indication of the level of concern. And it's not just because people see things on television, but they actually know somebody who's been involved with the immigration system and the potential risks of becoming involved with federal programs. Another 25% of respondents in Spanish expressed a concern about public charge. So these are issues that are very current and very much of concern in immigrant communities and in mixed status families. So for our most recent study, we reached out to service providers and agencies in Los Angeles County who provided a range of services, including housing, healthcare, nutrition, and medical care, of course, and received responses that contained information about that organization. So this is a survey of organizations that let us look at the level of concern in those organizations and what they were doing around the census. So at the most basic, among those of organizations that responded, 91.9% of community-based organizations reported that they had had organizational discussions and concerns about the impact of an undercount and how that would impact their organizations, their populations, and other services in their area. And among government agencies and large health systems, a similar proportion reported a concern at the organizational level around how an impact might have an effect in their communities. A lot of these organizations serve mostly or all Latinos, but the organizations actually were a broad cross-section of organizations. So about 2/3, 65% of the CBOs who responded to our survey served mostly or exclusively Latinos, and about half of the government agencies or health systems similarly had a primarily Latino population. This translated into a high level of outreach. So on the far left, you can see that on the bottom bar, almost 90% of our responding organizations were concerned and had talked about the implications of a census undercount and were actively involved in outreach. So California has put hundreds of millions of dollars into census outreach, and they've made grants to community organizations as trusted intermediaries who can reach community members in hard to reach communities. And a lot of these organizations have been receiving funding by the state to do community outreach. Just a few organizations who were CBOs had discussed the implications of a census undercount, but were not considering outreach. And a small number had not considered the implications. Some of which were doing outreach as well, even though at an organization level they hadn't been involved in the debates over the implications for their organizations. So those are probably organizations that are getting outreach grants. Government agencies and health systems, a slightly smaller proportion are doing outreach. And so you can see that about 3/4 of organizations who are agencies or health systems are doing some sort of outreach. And then the balance are similar numbers that did not consider the implications of an undercount. Similarly, organizations with many Latinos are more likely to be doing outreach. That's the graph on the right. So we also looked at a couple other dimensions. Increasing numbers of Latinos didn't seem to affect the numbers of organizations doing outreach. It was primarily community-based organizations were the most likely compared to government agencies, and high levels of Latinos compared to lower levels of Latinos. But the bottom line on this is all organizations, all levels of government have some concern in this area in LA County, and a large proportion of them are doing outreach to try to assure a complete census. One of our respondents talked about their outreach in this way. They reported that they say to individuals in their community, you're here in the center because it was funded and is supposed to target the lowest income households in the city of LA. Without your participation, we will have fewer of these centers in the city to support families in the way we're supporting you. So they're directly connecting people's participation in the census to the services that they're receiving and helping them get by. So how much money is at stake here? There's a organization, the Washington University, George Washington University in DC, that went through piles of government documents and looked at all of the different funds that are allocated or provided based on some data that had its basis in the decennial census. They came up with $1.5 trillion in 2018 nationally, gets distributed or generated because either directly or indirectly of census data. When they looked at programs and the dollars coming into California, it came up to $172 billion every year of funding comes into California, based in part or largely on census data. So they also provided information on the total census-driven dollars that are not including Medicaid and Medicare, and I'll mention that in a minute, and that's $49 billion comes into California outside of Medicaid and Medicare, which are very large programs, generate a lot of funding. And we estimate that of that, about $12.7 billion every year comes into Los Angeles County when you do not include Medicaid or Medicare. So our calculations that we're going to talk about now are all based on that $12.7 billion figure. So start with the good news. Medi-Cal is not impacted. That is the largest census-driven program in the country. It's census-driven because the federal matching rate for dollars is based on a calculation called the FMAP, the Federal Medicaid Assistance Percentage. So in California, for every dollar that is spent on Medicaid, the federal government provides half of that, or 50%. So federal FMAP ranges depending on the state's median per capita income compared to the US total per capita income. So wealthier states get a lower match and poorer states get a higher match. California already is at the minimum at 50%, and so it can't go any lower. If we end up with an undercount of immigrants, Latinos, low-income populations, that would, in effect, raise the per capita income of the state, and that would mean that California would be even less needy a federal match, but since we're already at the minimum, that's not going to change. There are some states, large states like Texas, that actually have a lot to lose if they have an undercount because their FMAP could go down. California, however, it won't. So we will stay focused on the $12 billion that does not include Medicaid or Medicare. So what are the best estimates of how much Latinos will be missed, how many Latinos will be missed in Los Angeles County? Since nobody can predict the future perfectly, we have three estimates, sort of a best case, an intermediate case, and a worst case. The best case we based on multiple sources that looked at past undercounts and assumed that the undercount would be at about a historic average, which would be about 2%. If Los Angeles County was undercounted by 2%, that would mean $117 million, according to our calculations, would not come to the county. That would come to the county if Latinos were fully counted. That's per year. If it's 5%, that would be about $300 million, $293 million to be exact. And a 10% undercount, we project would be a worst case scenario. The Urban Institute has a document that is mentioned in the appendix that we have as part of this policy brief that estimates a potential undercount by race and ethnicity, but it does not account for the chilling effect of policies that we're currently seeing. It doesn't account for the disproportionate residents of undocumented residents in Los Angeles County. And so we use their worst case scenario, add the additional amounts from other sources that could be a chilling effect from immigrant policies, and use 10%. And we're confident with that. As a worst case scenario, there are other organizations that have come up with 12 to 15% as a worst case scenario. So we feel that actually 10% is a conservative worst case scenario. So to get into all of the calculations and all of the assumptions, we do have a appendix, technical appendix, which is listed on our website. So the 286 million would be the result of a 10% undercount of Latinos in Los Angeles County applied to the 12.7 billion that the county currently gets. So that's about $500 million a year from an undercount of Latinos. So how does this work out into real life? So we looked at a series of programs as exemplars. Each program has different criteria for how the money flows. So we made some simplifying assumptions. We assumed that a 1% decrease in population would equal a 1% decrease in dollars. In reality, it could be lower or higher because of the complex funding formulas that every single program has. But one that's pretty simple to see is a response to the COVID-19 crisis. The federal government just recently approved $250 million extra in funds for senior meals. So a lot of seniors that have to shelter at home are not able to get food delivered. And so this would enable local area agencies on aging to increase the numbers of meals they're providing to shut-in seniors. The $250 million translates into $25 million for California. And the legislation that approved this stated that grant amounts are determined based on the population-based formulas defined in the Older Americans Act. So the Older Americans Act is a federal act that allocates money to states for a variety of senior purposes, senior meals being one of them, senior centers, a host of programs for older adults. The formula defined in the Older Americans Act is very simple. It takes the number of people age 60 and over in the country, looks at the proportion of people age 60 plus in a state, and then gives the state that fraction of the dollars available. So it's pretty simple to see that if California ends up with an undercount that's greater than the country as a whole, which it's likely to, given the data that I showed you on Latinos, renters, undocumented population, then the proportion of dollars coming into California would be lower than would be appropriate given the actual population there. So we would start with California with an undercount with fewer dollars. And then within California, there's a different formula for distributing the Older Americans Act dollars among different geographies. And that includes a complex combination of the number of people by age, the number of minority and non-English speakers, the extent to which the locations are geographically isolated, meaning rural, and the number of persons living alone. So all of those are based on census data. And so undercounts in any or all of those categories in Los Angeles County that are greater than the state as a whole would mean that Los Angeles County would not receive its full share of Older American Act funding for senior meals. In addition, the within California formula includes the number of older adults on Medi-Cal and the number receiving supplemental security income. Those are not dependent on census counts, and so the actual amount that we would lose is a little more complicated than the simple undercount would occur at the national level. So good news is there's more money coming for senior meals. The bad news is that if we have an undercount going forward, it would not meet the needs in the county. Existing home delivered meal funds include $7.85 million in federal funds for the county. So Los Angeles is a little different from the rest of the state. We have a county and a city agency that provides senior meals, and this is just the county portion. The county provides meals to 26,000 clients and 1 million meals per year. In the worst case scenario of a 10% Latino undercount, that would mean 30,000 fewer meals available to seniors who are in their homes and need meals for a nutritious diet. Another example of the way census data is used is in urban and rural classifications. There's a whole set of programs for rural areas, whether it's rental assistance, subsidized or low broadband rates, Medicare reimbursement rates, transportation, specific grants for areas that are not rural, but that are small towns and cities. And all of those are going to be influenced by census data. Section 8 housing vouchers is a program that provides a voucher for very low income families, which is defined as those whose income does not exceed 50% of the median income for an area. So once again, if there's a severe undercount of people who are in the low income categories in an area, the surveys that follow the census that determine income are going to be adjusted to those population totals and are likely to undercount the lowest income population. So that could influence how much each voucher is worth or how many people are considered needy in that area. And then it subsidizes a person's rent up to what is calculated as the fair market rent level, which is the 40th percentile of rents paid by recent movers. And so once again, so the total population is going to have an influence on what the fair market rent is calculated as. So using our simplifying assumption that undercount is a one-to-one dollar calculation, we estimate that as much as $14.6 million could be lost to families in Section 8 housing voucher value. SNAP benefits, food stamps is another one. Another complicated program that involves how long a person can receive these benefits is dependent on census data, which is used as control numbers for unemployment rates, and areas with high unemployment rates, higher than the national average, are able to provide food stamps to people for a longer period. Once again, based on the numbers of people served by food stamps, a loss of funding to the program could influence as many as 15,000 households. So in the policy brief that we have, we go through a set of programs that provide illustrations of the scope and potential impact of a census undercount for the 2, 5, and 10% undercount of Latinos. And what's important to note is that the loss of resources won't just be a loss of resources to Latino residents, but to all residents. So if fewer seniors have access to senior meals, it's not just Latino seniors, it's all seniors. If children have less access to hot breakfast, it will be in schools, it will be all children, it's not just the Latino population. So this means that a complete census count is essential so that we get the matching federal resources we need. And in looking through the most recent responses to COVID-19, which is not in the brief, there is even disaster planning money, which is funded in part by the number of people in an area. Makes sense. If you've got a larger population, you need more money for planning for disaster. And the CDC funds that come into Los Angeles County for disaster planning won't affect the money we get for COVID-19 planning because it's here, it's on us, but it could impact the amount of money that we get to plan for the next disaster. Since Los Angeles County's population has many populations that are at high risk for an undercount, this means that the impact of an undercount is going to be particularly impactful in Los Angeles County. And the high proportion of the population that is Latino means that the Latino undercount is going to have a particular impact in our county. As a result, community-based organizations, healthcare providers, and government need to make that extra effort to encourage full reporting. The outreach has been going on for a long time. The planning has been going on for a long time. The COVID-19 crisis, I think, throws a monkey wrench into all of the plans because the Census Bureau is delaying. It's knocking on doors for households that have not returned their forms. It's made more complicated reaching out into the community and has complicated the attention that community members may be paying to the census. But it's important because, as one of our respondents noted, any issues that our patients are facing, the census data touches. We're talking about housing, food insecurity, transportation, quality education, quality childcare, and affordable childcare. All of this impacts our communities, and it impacts our health and the health and safety of our communities. We want our communities to know that it's 10 years, and that's a long time to wait to be counted, and you deserve to be counted. So it's incumbent on all of us to let community members know that every person who responds to the census makes sure that there's the resources needed to provide meals for kids, food stamps for families, home delivered meals for seniors, primary care through community clinics, housing subsidies, and even in the ability in the future to respond to epidemics like COVID-19. So all of you should have received a letter like the one on the right. You should have received a second letter if you hadn't answered. I believe you'll receive a third letter. And hopefully as many people as possible will respond online and be counted so that Los Angeles County gets the full amount of resources that it needs to address the the needs at hand. And I think at that, we'll open it to questions.
Hello, everyone. My name is Tiffany Lopes, and I'm the Director of Communications here at the Center. I will be moderating questions from the audience today. We have a few questions already, and I encourage the audience to use the Q&A function in Zoom to continue to ask questions. So let's start with the first question. More and more individuals are living in accessory dwelling units, usually on the back of a lot of a single family home. Often these are renters. There may or may not be a distinct address. With the housing crisis and greater density, how can the census address this particular housing reality?
So accessory units are important. I think probably what's the most important are accessory units that are not built with building permits. So if you're in the front house and you get the census form and you're the owner of that front house, you're supposed to answer for all members in the area. So if the back doesn't have a separate address, you should answer for both the front of the house and the back of the house. If the accessory unit is not legitimately built, people may be tempted not to answer for the back of the house. So once again, to get back to the confidentiality issue, nothing that people put in their census forms can be used against them by any government agency. So it's incumbent on people to answer for both the front of the house and the back of the house. The Central Valley Center that looked at the follow-up to the 2010 census went into some of the backyard housing, which were in that area even more unofficial housing, and located a number of people who had not been counted in the census. And so once again, it's incumbent on people who are responding to the census to answer for everybody on their property that doesn't have a separate address.
Thank you. Another question is, did organizations you surveyed indicate whether they would have to start turning away seniors in need if funding is cut, or would they cut the benefit to each person so more people could be accommodated?
So the issue with senior meals is you can't deliver half a meal. So if you're cut 10,000 meals or 5,000 meals or even 100 meals, that's 100 meals fewer that you have to deliver. So you would have to either give people fewer meals per week or have fewer people receiving meals. And either way, you're reducing the nutritional benefit for older adults who are likely to have multiple chronic illnesses and would be more sensitive to having dietary issues if they're not receiving home delivered meals.
Thanks. How can the census reassure the undocumented that their information will be private and that ICE will not have access to the info through a loophole? I tried to convince the people I know, but they are terrified to answer any questions.
So that's a really hard question. So it's easy for you or me to cite federal statute and say that anybody who divulges anything out of the census is subject to fines in prison. We can talk about the fact that for the last 50 years, the census has been a lockbox and nothing has been used from the census to harm people, despite a lot of pressures by a lot of politicians to misuse the census. But when people see ICE agents knocking on people's doors or taking people out of courts or doing things like that, you can see where the fear of responding comes to. So I think the best solution is to have the most trusted people, and it sounds like the questioner is in an organization where they have the highest level of trust, to reassure people that the census is safe. It's a lockbox of information. As a researcher, I can tell you that the census is making information even for researchers both harder to get and less accurate. So they are taking their job seriously, and I'm not quite sure what else to suggest unless somebody else on the chat has some suggestions.
Thank you. How can the census take into account the rise of unemployment caused by COVID-19, seeing as many of the jobs impacted are those of Latino immigrants, and how can that impact the data?
So the census actually is a very simple set of questions. It asks the basic demographics of the population. The data that we have on unemployment is based on sample surveys that go out. The American Community Survey is a large one. The current population survey is really the source of employment information. And so those are additional census products. What's important about the every 10-year census is that that is considered the total number of people that all these other surveys expect to find. So if you're going out and asking 1,000 people, are you employed or not? And they want to generalize that to the state, they use the data from the census to say, oh, here's the proportion of people in the state that are young and old, black and white, male and female, large households and small households. So they don't actually collect employment data on the census, but the employment data that is collected, the employment rates, do at the end of the day end up drawing on census data.
Thank you. How are you able to know how many individuals are not counted? How do you verify the completeness of the census?
Yeah, it's sort of counterintuitive, isn't it? If you didn't find them the first time, how would you find them the second time?
Exactly.
Yeah, so the census does go back, and actually, I don't know if Todd's still on the line. He may have a more complete answer for this. But they go back and they resurvey selected areas where they expect they might have had a hard time finding people. And then they compare their sort of second high intensity survey or enumeration with the earlier enumeration and see who they found, who they hadn't found through their just sort of normal mail-in, fill out the survey online, or the going to the door a couple times with their census enumerators. So it's a resurvey, and then who do they find who they hadn't found the first time. I think there's I don't know, Todd, if you have anything to add to that.
No, that's essentially how it's done.
Okay, so the expert from the census.
There you go. Do you think that the ad campaigns on targeting undercounted or underrepresented populations are working?
So I guess we'll find out about that when we actually get the data from the enumeration. Ad campaigns have variable impacts. I think the most recent example of ad campaigns and whether they work or not is the Covered California campaign about 6 years ago for signing up for the Affordable Care Act. And they poured tons of money into ads. And as they were watching the numbers of people sign up, data, including data from the UCLA Center for Health Policy Research, suggested that a lot of Latinos were being missed. And that despite the fact that there were plenty of ads in Spanish and plenty of forms in Spanish, they were trying to push people to do a very complicated application process through a web interface. And it wasn't until local community groups got really involved and started providing face-to-face support for signing up for Covered California that the Latino signups actually rose to about the level that was expected. So advertising in and of itself might not be enough, especially for this population, and it may require more of people just sitting down and saying, yes, here's the form. It's really not that much information. There's nothing sensitive, and it's kept in a secure location. Nobody else is going to see it, and it's just going to be added together so we know how many people the federal government needs to give money for housing and healthcare for. So I guess the long answer is, the short answer is we don't know. The long answer is I don't think advertising is enough in and of itself.
Got it.
I don't know if Homero, who's on the line, has anything to add to that.
Sorry, I had to unmute myself. No, I have nothing to add. Thank you.
Did you want to talk about resources briefly while you're on?
Yes. So again, thanks for the great presentation. The one thing that I would add is, on top of all the challenges, there are also scams that are circulating, online and through WhatsApp that people are sending to each other. One of the more recent scams is that you need to sign up through this special census website before you can get any money from the stimulus package. So again, just lots of misinformation that's going around. So I recommend, what I'll do is I'll send a website in Spanish perhaps, so we can, I will share that through the chat function, a website in Spanish, and also an 800 number that people can call or they can give to their clients that they can use if they're Spanish speaking. So let me do that right now. But again, I think besides all the challenges already mentioned, the new challenge, the new layer is all the misinformation that's being perpetuated out there. And I think that's going to be another hurdle.
Thank you. With 1 in 6 households receiving a longer questionnaire, do you foresee that there will be an even bigger issue of an undercount for the long form? If yes, in what way?
So we actually got rid of the long form in 2000. So everybody gets the short form. And what happens is that we now have the American Community Survey, which is a very large follow-up survey. Problem with the long form was we did that once every 10 years. And in a rapidly changing country, by about year 5, the information on the long form, which included a lot of economic information, was outdated. So now they do the American Community Survey, which is another census survey. It's a large survey, but it's not a complete enumeration like the every 10-year census is. And that includes information on health insurance coverage and income and a whole host of other social and demographic characteristics. So that isn't a concern for the every 10-year census anymore. But once again, so the American Community Survey uses that every 10-year census as its control totals. So if we're short 500,000 people in Los Angeles County, when they do their American Community Survey follow-up to get additional information next year and the year after and every year, they will assume that there's fewer people in LA County than there really are. And that'll have implications for the federal funds and other resources that come into the county.
Great. Are there any lessons to be learned from the 1920 census about the impacts of a worldwide pandemic on a complete population count?
So that's interesting. I'm not a historian of the census. I don't know, Todd, do you know anything about the 1920 census?
Unfortunately, no, I'm not a historian either.
But that would be, I mean, that's actually an interesting question because the Spanish flu hit in 1918, 1919. I would say it was a different era then. In 1920, they still went door to door to do the census. So the Spanish flu, which killed a lot of people, was pretty much over by 2020. And so it might have had an impact on the number of people they found. When you look at like the US population, it is interesting because there is a dip in 1918, 1919 in the total population because of the Spanish flu. It was large enough and severe enough that it had a noticeable drop in the total population in the country as a result of it. So I don't think in the 1920 census probably that it had much of an impact. I think the current COVID-19 situation is different because we're relying on people to take initiative to return information from the census.
Thank you. I think there's a dog maybe that has a question.
Yeah, unfortunately that's my dog. We'll see what we can do with her.
We have a couple of other audience questions to get to. So you stated that Medi-Cal will not be impacted. Can you explain again why?
Sure. So it's Medi-Cal funding won't be impacted. So Medi-Cal funding from the federal government, there's a match rate. So another way to look at it is for every dollar the state of California spends on Medi-Cal, in general, there are a lot of exceptions to this. Sometimes it's usually higher in certain instances, like the Affordable Care Act. Expansions, they give a higher amount of money. SCHIP has a higher amount of money, but the base funding, which is dollar for dollar or 50% of all the amount of money spent is based on a calculation of state income, basically. So the per capita income. So if people in California have higher incomes than the national income, the matching rate is lower. What this does is it gives states, including, say, Mississippi, Alabama, even Texas, a higher matching rate because their state income per capita is less than the national average. So in California, if we undercount people who are more likely to be lower income, then when they do the income calculations, it'll make the state look even wealthier per capita than it really is. That, since we're already at the bottom, we're at the floor, we can't go any lower. So an undercount would not take federal dollars away from us in Medi-Cal. It would potentially in Texas, Louisiana, many of the southern states that get FMAPs, they get matching rates much higher than California does. So they have room to go down if they're undercounting low-income populations. We don't.
Mm-hmm.
I hope, does that make sense?
I think so, yes.
Okay.
What are the reasons males ages 30 to 49 are being undercounted, and what is the other age group?
So the younger males were the second highest. When the report from the Census Bureau, they found males were more likely to be undercounted in that age range, and the sort of middle-aged males were the least likely to be counted. Part of that, younger males in particular are more likely to be mobile, less likely to have permanent addresses. My guess would be more likely to be skeptical of public programs. I actually don't know why the slightly older males have a higher undercount rate than the slightly younger males. Once again, I don't know if Todd is an expert in all things census from his experience, but that was what they found when they did the resurveys. Do you have anything to add, Todd?
I'll add that I am not an expert in all things census. My experience at the Census Bureau was limited to the ongoing survey work that they conduct.
Okay.
Great. So those are all the questions we have for today. I just wanted to thank you all for attending this month's seminar on the Latino Census Undercount, and thank you to Todd Hughes and Dr. Stephen Wallace for this important and timely discussion. To echo Todd earlier, if you haven't already, please make sure to fill out the census and be counted. We will be posting the recording of the webinar online with closed captions within the next 2 weeks. Please visit healthpolicy.ucla.edu/seminars. As a reminder, if you'd like a copy of today's presentation, please email us at healthpolicy@ucla.edu. We know this has been a difficult time for everyone and wanted to thank you again for taking the time to join us virtually today. Please take care of yourselves during this pandemic. We look forward to seeing you in person when we get through this difficult time. Stay safe, stay strong, stay home, and